The following segment is sponsored by Northern Nevada Health System.
We're at the Northern Nevada Health System with Jeannette Caron, who is a speech pathologist, talking about acute rehab and what it is. Hi, Jeannette.
Hi, thanks for having me.
Thank you for explaining what acute rehab is. What is it?
So acute rehab is where a patient will come in for 3 hours of intensive therapy with a physical therapist, occupational therapist, and sometimes a speech therapist to get back home.
How does acute rehab differ, though, from outpatient rehab?
Outpatient, you go a couple times a week to a facility that's more like a doctor's office or a gym, where the acute rehab's in like a hospital type of setting.
So, and then what point would a patient need acute rehab versus the other type of rehab?
Yeah, they would need acute rehab if they're not quite safe, strong enough to get home on their own, or even with family. They're trying to rehab and get stronger, and they're able to tolerate 3 hours a day of intensive therapy so you can go home.
That would require time in the acute rehab unit then?
Yes. They don't go home. You are there 24/7 with all of us. We're outpatient. You're just going in daily or every other couple days.
What kinds of services are offered in the acute rehab unit?
Acute rehab, we have the doctor, the nurses, and the CNAs that oversee the medical side of care. And then you have your physical therapists, occupational therapists, speech therapists that help with the rehab, strengthening, body, mind. And then you have your dietitians even that help make sure they're getting enough nutrition, hydration to participate and to get home safely. And then you have your case manager that is making sure everybody's ready for discharge on the day that they even come. They're trying to make sure parents, your family, friends, and your durable medical needs are being met before you even get home. So everything's in place.
Speaking of family and friends, is it where there's a chance to visit? Will you have visitors in the acute rehab unit?
Yes, we actually want family and friends to come in to participate even in the training so they know what to expect when their loved one goes home. So not even just visiting, but partaking in the therapies themselves.
So Jeannette, you have the speech pathology as part of the acute rehab unit. What other services?
We also have the physical therapist who will work on strengthening and balancing, waist down type of walking, getting around up and down stairs, going down the driveway, so at angles. You have your occupational therapists who are going to help with getting dressed, doing your grooming, doing your cooking, and then speech therapists, we work on like medication management, finance management, those kinds of things.
Boy, so you hit it from all different angles to help the patient.
Yeah, to make sure they're safe when they go home.
More on what Jeannette does is found on our website, which is mynews4.com. And we're going to take a still photo.